It is the News Blitz with Randy Wang on Talk Radio 790 KABC. We're here every single day from 5 to 6 talking about the local issues that matter to you most and taking your phone calls at 800-222-KABC, 1-800-222-5222, your emails at randykabc@gmail.com, and search for the KABC News Blitz wherever you get your podcasts. Something very interesting happened today at the LA County Board of Supervisors meeting, as the 5 supervisors had to discuss a new executive order that has come from the federal government that, if implemented, would mean a severe cut to the budget in the county when it comes to homelessness and housing first. In fact, this executive order from the federal government, if enacted, would ban federal funding from counties and states that practice things like housing first and harm reduction and safe consumption. And as somebody that has turned into kind of a wonk on all these issues from all the research I've done over the years, it was very interesting to hear this debated at the Board of Supervisors. But before we hear what the 5 queens have to say about this, that's their term. They call themselves that. Let's hear what exactly is in this executive order. Here's the new head of the Los Angeles County Homeless Department. Apparently we didn't have one of those before, but when we divorced from LAHSA, now they have their own department, and here's the head explaining all the cuts that are coming from the feds.
On July 24th, President Trump issued an executive order entitled Ending Crime and Disorder on America's Streets. It sets forth the president's new approach to homelessness and the use of civil commitments. I'll begin by providing an overview of the directives within the presidential executive order. It directs the Attorney General to seek reversal of court decisions and termination of consent decrees that impede civil commitment of people experiencing homelessness who have mental illness.
Okay, now, if you don't understand what that means, congratulations, you have a life. What's that like? What they're talking about here, the first act of this, is to make it easier to involuntarily commit somebody who's living on the streets. Something right now that is very difficult to do. Even with everything Gavin Newsom has talked about with conservatorship reform or the big publicized care court, that thing is voluntary. It is still very difficult to involuntarily commit somebody to mental health treatment or rehab when they are not in a capability of making that decision for themselves. That's where we are right now.
It prioritizes discretionary federal grants to states and municipalities that enforce laws that prohibit open illicit drug use.
Okay. That's another important thing. If this executive order is enacted properly, it would cut funding from states like California that have essentially decriminalized drugs with Prop 47. And Prop 36 was a great step in the right direction, but it's not properly funded. We don't have the treatment beds. And ultimately, we're still seeing in places like Los Angeles and San Francisco open air drug markets. So yes, cutting funding from states that allow that nonsense, all for that.
Urban camping and loitering, and tracks the location of convicted sex offenders.
Oh, yeah. There's another thing, because made up in a lot of these encampments are people that recently got out of prison. And some of those people that were in prison were sex offenders, including some of these encampments that are right outside of schools. We know this has been a thing. It's been a thing for a while. It's one of the things that will happen when you decide that it's the policy of the state of California to empty out the prisons as fast as possible.
It instructs the Attorney General to assess whether federal resources may be directed towards ensuring that people who have serious mental illness and have been detained are not released to the community because of a lack of forensic beds.
Okay, if someone's clinically insane, we have to hold them until we have a place for them. You don't put an insane person back out on the streets. So far, I like what I'm hearing. We'll see how it's implemented, but the fact that the county is discussing this executive order says that they're taking this seriously. Because ultimately, the thing that the county and the supervisors care most about is funding. And if they're not getting federal dollars for a lot of these programs, they might not be as inclined to do it because it's going to cut out of their budget. You'd be surprised how many things local and state governments do just because they know there's federal funding attached to it.
It also directs the Attorney General to enhance requirements for in-custody housing release plans for inmates, requiring individuals to comply with these plans to the maximum extent possible. It directs the
meaning not just putting people out on the street with no plan for success.
It directs the department.
Again, we're going to need funding for that, and our whole prison system needs to have massive reform. But right now, what we're doing isn't working. And if you start from that point, we can only go up. But you have to admit what we're doing isn't working. And the problem that we have is our local elected officials, and this is bipartisan, this is not just Democrats. Catherine Barga is a Republican. They will not admit that our system is completely broken.
It directs the Departments of Health and Human Services, or HHS, and Housing and Urban Development, or HUD, to increase accountability in their provision of homeless assistance and transitional living programs. This includes ending support for Housing First policies, which have been for decades the policy of the land.
And when I heard that, that's when I said, click, and I hit record on this. Because it has been quite some time since the discussion, the idea of Housing First was actually talked about at the LA County Board of Supervisors, especially considering that the author of the state of California's Housing First law happens to be Holly Mitchell.
Quite frankly,
when she was in the state Senate. And it differed quite a bit from the Housing First policy set by the federal government decades ago, which included treatment and mental health care. Holly said, we don't need that. We just need the housing. We need nonsense called permanent supportive housing, which, if you just think about that term, what exactly are we saying? That every single person that's on the street right now can never turn their lives around, and we're going to have to pay for them in a subsidized apartment for the rest of their lives? That doesn't seem like the great attitude. You know, you don't hear a lot from the public stories, but when it comes to people that have turned their lives around through some of the more private systems, whether it's the Union Rescue Mission or the Salvation Army, the nonprofits that are literal nonprofits because they cannot get government contracts because they have a religious angle, well, those people don't end up in permanent housing. They're in temporary shelter. They're in rehabilitation to get whatever's wrong with them under control so they can rebuild their lives. And that's something you don't hear about a lot from LA County, is people getting out of all this and rebuilding their lives. We want them to be a ward of the state because that means more funding. Ultimately, it all comes down to dollars and cents, and this takes away those dollars, which could be a big deal.
It instructs HUD to take steps to require recipients of federal funding and homelessness assistance to participate in substance use disorder treatment or mental health services.
Yeah, how about that? If we're paying for your housing, you have to go to treatment. Because you know what? If you don't have a mental illness and you don't have a drug problem, why exactly are we paying for your shelter? If it's just too expensive to live here, that's another debate for another day. But as I will always say, you don't have to live here. There are hundreds of thousands of people that cannot afford to live in Los Angeles that chose to move to Palmdale, that chose to move to Riverside. So even though they deal with these hellish commutes, and believe you me, no one hates commutes more than me, but they didn't just say, okay, I'll live on the street or in an RV, because that's not a real option. And the fact that we made that an option is insanity.
The order specifies that federal discretionary grants for substance use disorder prevention, treatment, and recovery do not fund programs that apply harm reduction or safe consumption efforts.
That's incredible. That would be a death blow to Barbara Ferrer.
The evidence is like crystal clear on that.
Because it's Barbara Ferrer that takes local, state, and federal dollars and gives them to organizations like Homeless Healthcare Los Angeles, a nonprofit that gets thousands of dollars every year to operate a storefront on Skid Row and pass out needles, meth pipes, foil, straws, spoons, and other drug paraphernalia in this nonsensical idea of we're going to reduce the harm because they're less likely to share those things with others and get an explosion of hepatitis or AIDS. Meanwhile, we are encouraging and exacerbating these addictions. That policy has got to go, and I don't care what's your opinion. You never take everything as a whole. Not everything that's going on at the federal government is something that I like. Not everything that's going on at the state government is something I hate. You take each individual issue and you look at it and you say, yes, this is something that LA County is doing that makes no sense, and it's time for the federal government to say, we're not paying for that. And while some people, like Ferrer, are ideologues, the supervisors really care more about the funding. And we'll find out if they really care about these issues once the well dries up.
Finally, the executive order requires recipients of federal funds to collect health-related information when identified as necessary by HUD and to share this information with law enforcement in circumstances permitted by law.
You know, in case we're paying for housing for anybody that has, an active warrant or what have you. But that was the outline. That was the head of the new homeless department of the county. Let's hear what the supervisors had to say about all this. Starting with Janice.
Start with Supervisor Hahn.
Thank you, Madam Chair. Well, there's a lot in this executive order to not like. And those were all very thorough reports.
You can tell that Janice has no idea where she's going when she starts speaking.
I was like, But, for the public listening,
and thanks to this program, the public actually is listening. How many people do you think watched this video today? Because they broadcast every one of these meetings on YouTube, and I love that they do that. This is a county of 10 million people. Currently, there are 210 people watching. I think I have an audience a little larger than that. So that is why I listen to these things and I bring you the sound, because ultimately what's going on with the county, not that many people pay attention to, and you really need to it. As much as that phrase is overused, when Gavin Newsom says localism is determinative, there is something to that. This executive order won't mean a whole lot at the big looking at it bird's eye view. But microscopically looking how this affects the local budget of LA County and the Department of Public Health and Department of Mental Health, you can see how this can have a big impact.
There's a lot of people that, are, at least this.
I've said this before and I'll say it again. Janice Hahn has never said the phrase that pays.
Quite frankly.
But she says, like every other word.
There's a lot of people that, are,
that was 3 in how many seconds? In 4 seconds.
There's a lot of people that, are,
Just remember when you listen to Hilda and Holly and Lindsay and Catherine and Janice, that they all make $300,000 a year and are the most powerful local politicians in the country. Nobody has bigger constituencies than the 5 Queens. Nobody has bigger budgets than the 5 Queens. Again, that's the term they use for themselves.
At least this guy's doing something, right? We also feel like maybe there's not enough accountability in our homeless programs. And, the public is, feeling a little bit like, is this an industrial complex that's not actually solving the problem?
Why, yes, That is what we're feeling, because you've had all these policies for years and years and years, and they have not solved the problem. And you look at the negligible drops in the numbers of homeless that are put out by LA County and LA City and Karen Bass saying, look how much of a success we're doing. And you just ask yourself the question, is that drop in homeless really a success of your programs? Or do you have a bunch of people overdosing every year because you're encouraging them to keep doing drugs?
So, Sarah,
especially when Karen Bass got into office, she campaigned on, I can't believe this, 5 people a day in LA County are dying of homelessness. And 2.5 years later, 7 people a day are dying of overdoses that are homeless. 7.
So, Sarah, I was going to talk with you, and maybe Emilio, you can fill in, and maybe even Dr. Galley, in terms of the housing first.
By the way, I noticed Ferrer wasn't invited to this meeting. They know they don't want her talking about this because she'll only get them in trouble. They'll still pay her $600,000 a year, but she wasn't invited to the meeting.
The housing first. That's the one that hits me the biggest. And for a lot of people, right, it wasn't always the law of the land, right? I feel like it wasn't.
We used to require treatment if we're going to give you a shelter. And this idea of permanent supportive housing, which is unique to the state of California and specifically Los Angeles, didn't make any sense. Because why would you need a permanent place for somebody that needs a little help?
You know, even when I first ran for office, it was pretty much, if we're going to give you a house or a roof over your head, you've got to do some stuff, right? You've got to get into a drug treatment program. You've got to show that you're, willing to improve yourself, pull yourself up by your own bootstraps. Well, I think everybody found out that really didn't work because.
Look at the way our streets looked before these policies of housing first, and look at our streets now. When this city had zero tolerance for illegal drugs, it was a little different than it is now. And I'm not saying what we did back then was perfect. I think treatment makes a hell of a lot more sense than 20 years in prison for a drug problem. But what we're doing right now is just letting people die on the streets, either instantly, thanks to overdose, or over a very long time, because our best answer is to revive them and then give them the tools to continue using the drugs. Oh, and a whole bunch of general assistance money so they can continue to buy the drugs. 800-222-KABC is the phone number, 1-800-222-5222. What do you think of the federal government's executive order to cut funding to places like LA County that have policies like housing first? Is it time to do away with the housing first policies when it comes to homelessness in California? 800-222-KABC is the phone number, 1-800-222-5222. Get on the line right now. I know you have an opinion about this. Make your voice heard. 800-222-KABC. We'll hear from you. We'll hear from Janice and Hilda and Holly and the rest of the bunch next. It's the News Blitz with Randy Wang on Talk Radio 790 KABC. It's the News Blitz with Randy Wang on KABC. We're taking your phone calls at 800-222-KABC, 1-800-222-5222. Thanks to a new executive order from the federal government, it looks like funding is going to be cut to states and counties like LA County and the state of California that support policies like Housing First, which got us into the hole that we're in. Your reaction to the Fed saying no more funding for Housing First and harm reduction. Give me a call right now. 800-222-KABC. Let's start with Maria in Santa Clarita. Maria, hello.
Hi, Randy. And I totally agree. They definitely should cut the funding. We waste so much money. I listen to you guys all the time, and we need to do something better that works.
Well, and it's so funny because they always talk about how expensive it was to incarcerate people, even though we probably should be funding mental health facilities and more on that later. But the cost of all of these programs, the cost of all the nonprofits, the cost of all the failures is infinitely cost us more money than when we were just keeping everybody inside a facility.
Most certainly.
Thanks so much for the call, Maria. Appreciate it. Let's go to Bill in La Cañada. Bill, hello.
Hey, Randy, I'm glad you mentioned that fake Republican Catherine Barger. I've had it up to here with her. She's part of the problem. She goes along with this stuff. She's there for the ride, and she says telling statements like, "Oh, let's not get law enforcement involved with the unhoused on the MTA." That's a tip-off that she's part of this crap. But why would the federal government, meaning the rest of the United States, have any interest in funding Los Angeles when it's violating, as you point out, it's violating federal drug paraphernalia laws? And even worse, that if you think about it, who are these criminals getting their drugs from? They're getting the drugs from the Mexican drug cartels. So we're really, Los Angeles County and city officials are helping to fund the Mexican drug cartels, and that money is getting circulated back to these corrupt nonprofits, which are just filled with criminals who could not get normal jobs. So why would the United States have any interest in promoting this?
Well, they have had an interest for a very long time, but it's time to change that. If you take away the dollars, you'd be shocked how quickly the ideology changes with a lot of these local electeds. Thanks so much for the call, Bill. Appreciate it. 800-222-KABC is the phone number, 1-800-222-5222. The federal government is threatening to cut off all funding to states when it comes to homelessness if they participate in housing first policies and harm reduction. What do you think? 800-222-KABC, 1-800-222-5222. We'll take more of your calls and we'll hear what Hilda has to say about this, including a very interesting discussion about opening up locked mental health facilities. That's coming up next. It's the News Blitz with Randy Wang on KABC. It is the News Blitz with Randy Wang on Talk Radio 790 KABC. We're here every single day from 5 to 6 talking about the local issues that matter to you most and taking your phone calls at 800-222-KABC, 1-800-222-5222. Your emails at randykabc@gmail.com and search for the KABC News Blitz wherever you get your podcasts. We are playing you sound from today's LA County Board of Supervisors meeting starring,
Quite frankly,
I
love the bus driver.
those five, as they discuss a federal executive order that might be implemented very soon that would cut a whole bunch of federal funding to places like LA County for some of their homeless programs that involve housing first and harm reduction. And while a lot of this meeting was about the doom and gloom with the budget cuts and what are we going to do, and apparently Measure A is already underwater and the Department of Homelessness already needs more money than it's bringing in from the recent doubling of the sales tax. But there was one very interesting part of this discussion where even the Department of Mental Health happened to say, while we disagree with almost everything in this executive order, there's one part that we are in alignment with, that we want to work with the federal government with, and dare I say, it could be a game changer. And the fact that the federal administration and LA County are on the same page about something is interesting. Let me hear Hilda ask about, and we've talked about this on the show before, but it's something that you don't hear about often, the Medicaid IMD exclusion. That is a policy that prohibits federal funding for inpatient care in mental institutions with more than 16 beds. If you're wondering why we can't just reopen mental hospitals, why we can't take some of the abandoned hospitals, like the one that the owner of the LA Times is just sitting there, or the one in Norwalk, it's because, and again, it all comes down to funding. Because of a federal law, you will not get reimbursed Medicaid dollars for mental institutions that have more than 16 beds, which is one of the dumbest policies I've ever heard in my life. But what's interesting here is LA County admits that, and the new federal government admits that. So let's hear what Hilda has to say about this.
Thank you. I have a question for DMH. You talked a little bit about the IMD exclusion, and there may be some hope there. What is that? Spell that out. What does that mean for us?
Hilda, explain it to me like I'm 5.
Thank you, Supervisor, for the question. So the executive order, as our colleagues have noted, talks about setting a direction for the federal government that would increase civil commitments and also increase possibly involuntary treatment options.
Involuntary treatment? I'm listening. Tell me more.
Our department, along with the CEO and both Mr. Nikita and Ms. Ovalle.
Because right now our policy is beg people to get into treatment over and over and over and over again until they earn our trust. Meanwhile, they're literally killing themselves every single day, and we just keep reviving them with Narcan. That's insanity. When really, we should be taking these people and against their will, taking them off this poison.
Our department, along with the CEO and both Mr. Nikita and Ms. Ovalle earlier, spoke to the conversations that the county leaders, including Dr. Wong, who's in Washington, D.C. right now, have been having with administration officials from the Trump administration, as well as our colleagues and members of Congress, about lifting or easing the IMD exclusion.
We could have a waiver that, hey, California, if you want to expand your current mental health facilities to more than 16 beds, which doesn't make any sense, if you want to build a mental hospital, if you want to build a locked facility, we'll give you the funding for that, which completely changes how a lot of these elected officials will think on this issue, because it is not about ideology with so many electeds. Some of them are crazy ideologues. Most of them care about the money. And if there's money to build a locked facility, that's a big deal.
Our argument, or one of the arguments that we are making, is that this is one area where the county actually is in alignment with the executive order. I see the quizzical look. Give me a second here, which is that we also have a longstanding board policy to lift.
Bless you. Who was that? Barger?
To lift or reform the IMD exclusion rule. We believe that once the exclusion rule is lifted, we would be able to bring in more federal dollars and leverage those dollars to expand our local system of beds.
Which currently, because of this stupid federal law, means that we can build as many mental health facilities as we want in California and really across the entire country. And they can only have 16 beds in them because we don't want to warehouse people. Well, what's happened is that's impossible to fund. It's impossible to build that many facilities and staff that many facilities if they can only have 16 beds. So what do? We leave everyone out on the street.
This board for many.
If you're completely insane, you should be in a locked facility. If you are strung out on drugs, you should be in a locked facility until the drugs are out of your system and you're ready to restart your life. But instead, we go for housing first, where we put these people in an apartment, and that's all that matters.
This board for many months has been receiving reports about the shortages of beds in certain parts of our residential treatment system. In particular, we have highlighted at DMH the need for an expansion of our subacute beds. Right. Those are beds for people who do not need to be in a hospital, but do need long-term care for many months to stabilize on psychiatric meds and with therapy and other support services. We do not have enough of those beds in our system today.
Because you can only build 16 in one facility.
But lifting the IMD exclusion, we believe, would bring in the vital federal resources that would allow for those facilities to both expand, the ones that are here today, and also for the creation of new facilities. Because one of the biggest challenges that those businesses have, those facilities have, is setting up a financial model to operate.
most of these don't make any money. They lose money. And when governments need to cut budgets, that's one of the things that gets cut. That's why we close these mental hospitals to begin with. Well, this all sounds great. And I think everyone on every side of the political aisle should be excited about the fact that LA County and the federal government are in alignment with this rule makes no sense. And we should be able to build mental health facilities and drug treatment facilities, locked facilities, with more than 16 beds. But what do you know? There is somebody that's not too keen on all this. She's known as the godmother of Housing First. Holly Mitchell will tell us what she thinks about all this.
Chilly Willy.
When we come back. It's the News Blitz with Randy Wang on KABC. It's the News Blitz with Randy Wang on KABC. We're discussing the LA County Board of Supervisors' reaction to the federal executive order that could cut off funding for things like Housing First and harm reduction. But one bright point in all of this on all sides is the federal government and the LA County both agreeing we need to do away with this nonsensical rule called the IMD exclusion, which cuts off Medicaid funds to mental health facilities with more than 16 beds. Holly Mitchell, who authored and passed the Housing First law that the state of California uses to this day, has a problem with this.
And I wanted to explain my reaction in your conversation, Department of Mental Health, with regard to IMD waiver. We have all lobbied DC since I first got elected. The reaction you saw from me is you stated that the executive order embraces involuntary placement. And that's not our vision of what our facilities would look like if we were given an IMD waiver.
What do you think it would? The whole point is there are people right now who are not in their own right mind to say that they need help. They need treatment. And obviously they're not in their right own mind because they're living on the street. Whether they're severely mentally ill or severely drug addicted, if we had the ability to force these people into treatment, we would have not only cleaner streets, but these people would actually get a shot at life because they need the treatment. But Holly doesn't want that. Of course she doesn't. Holly Mitchell continuing to be the most destructive member of the LA County Board of Supervisors.
Will.
We'll hear what Catherine Barger has to say next. But first, 790 KABC welcomes Disney's Tim Burton's The Nightmare Before Christmas, live in concert at the Hollywood Bowl on October 26th. Tickets are on sale Friday at Ticketmaster.com. But right now, caller number 9 at 1-888-790-5222 gets a pair of tickets to the show, The Nightmare Before Christmas, live at the Bowl. Tickets furnished by Live Nation. Good luck dialing. It's the News Blitz with Randy Wang on Talk Radio 790 KABC. It's the News Blitz with Randy Wang on KABC. Let's hear what LA County Supervisor Catherine Barger, the lone Republican on the board, has to say about the federal government wanting to cut funding for Housing First and harm reduction.
I use the Housing First model. If you ask 5 people to define Housing First, you're going to get 5 different definitions of Housing First.
Is that Janice going right in the background?
5 different definitions of Housing First. I have constituents who are appalled that we do Housing First. They think it is simply putting someone in an apartment and walking away.
That's what it is. And that's why you look at places like San Francisco, most of the overdose deaths now are indoors, not outdoors.
And nothing could be further from the truth. So I think we need to do a better job of educating the public about what Housing First is.
Oh, maybe we just have this all wrong. Okay, so what is Housing First if it's not just putting somebody with 4 walls and not solving their problems?
And I will say, having sat on LASA, I was frustrated that there are some that do not do Housing First the way I believe it should be done. It's important to get in there immediately to provide the resources to gain the trust of the individuals who have many are service resistant. And so one of the complaints I heard from clients was that they didn't see a social worker for 2 weeks.
Oh, so then Housing First is exactly what you just said it is not. We're just shoving people in motel rooms with nobody there to help them. If you don't see a social worker for 2 weeks, it's very possible by the time the social worker knocks on your door, you've overdosed. So Catherine Barger just proved her own fallacy right there.
And a lot can happen in 2 weeks, which also impacts our ability to get people.
So it's not about what the policy is that you think it should be. It's how the policy is enacted in the state. And thanks to people like Holly Mitchell, we're not allowed to spend state money on mental health treatment facilities and drug treatment facilities. Not allowed to do that. All the housing that we have has to be no barrier, which means no rules, which means if you've got no rules, you got no boundaries, and you've got nobody here to make sure we get your life on track, Housing First means that you're sending somebody to a room where they might die.
That are willing to be part of our Housing First model. Because if you don't get the help in there in 2 weeks, a lot can happen to that unit in 2 weeks. So
yes, it could burn down.
So we have a responsibility as well to make sure that when we talk Housing First, that we are actually walking it as well and holding our providers accountable.
Then why are you talking about how different it is? That's literally what's going on. It's a complete failure. And to defend this complete failure is just nonsense.
To make sure that they are in there on day one, to be there to provide those resources. I think that is important, but I do believe that we need to.
You know where people get checked on day one? When you put them in a hospital, because that's the kind of setting that these people need. There may be some people that are down on their luck, but for the most part, the tents, the encampments, the erratic behavior, we know a lot of that is caused by drug addiction and mental illness. And if we want to be completely honest about it, and this is something that does not get talked about enough, sure, there is homegrown mental illness, but there is a lot of schizophrenia and psychosis on the streets that is caused by methamphetamine addiction. And what do? We just encourage people to do more meth by giving them pipes. So I am glad the federal government wants to cut funding for nonsense like that. At this point, LA County might not even be able to afford the salary of Barbara Ferrer. But I'm also glad at the same time, maybe, just maybe, we can all be adults and realize what we've been doing isn't working and work together to find a solution that does work. And I think the first step in all of this is LA County working collaboratively with the federal government to get the waiver for the IMD exclusion. We're never going to have the amount of money to solve this problem until we can start building and even just expanding our current facilities to create locked facilities where people don't have a choice, they have to go. Because we've been trying giving these people a choice for over a decade, and it has led to a massive failure. Thank you all so much. We will keep you up to date as this issue continues to brew. It's the News Blitz with Randy Wang on Talk Radio 790 KABC.